Okay, so today in this video, I'm going to go ahead and be doing a blood transfusion. So before I go into my patient's room, I'm going to go ahead and check my documents on the patient. So I'm going to be checking my doctor's orders, seeing the patient, everything on here. I have to do vital signs every 4 hours, blood transfusion, of course, of RBCs. I have to give a Benadryl before I give this patient blood prior to blood transfusion. I have to make sure they have a type and cross, and then I'm going to go ahead and go into my other documents. And then I have this document that me and the nurse sign once I get the blood. I have the blood bank slip that I'm going to go ahead and compare my blood with. And then I make sure that I have a consent form and make sure that the doctor did go talk to the patient. I would see the doctor's signature, and it just needs my signature, but once I go to the patient, I'll go ahead and sign it if the patient understands the whole procedure and doesn't have any questions. So now that I got all this ready, I'm going to go ahead and go into my patient's room, and I'm going to go ahead and knock, and then hello, introduce myself. My name is Alexis Salcedo. I'm an EPCC nursing student. Today I'm going to go ahead and be giving you a blood transfusion, but before I go ahead and start, can I please have your name and date of birth? So the patient's going to go ahead and tell me Blair Johnson, 56-year-old male, 7/11, 1963. I would go ahead and check with the ID bag, and it seems like I got the right patient, so I'm going to wash my hands, and I'm going to go ahead and ask the patient. I see that the doctor went ahead and came in here and told you about the procedure and told you everything that you need to know. Is there any questions that you have, or something that you didn't understand that you want to go ahead and call the doctor? I could go ahead and call the doctor back so he can explain this for you. If the patient states no, I would go ahead and sign the consent form as a witness that the patient understands the procedure and everything that's going to be happening and going on, all the complications. But if she did have questions, I would go ahead and call the doctor. So now that the patient's okay with this, I would put the documents aside. I'd gather my equipment, so I would need a sodium chloride bag. It wouldn't be clamped, just for the purpose of the video. I have it clamped already because this is old. And then I would have a Y tubing as well. Some alcohol swabs. So I have my alcohol swab, normal saline, all my equipment. So I'm gonna go ahead and wash my hands and put on some gloves. So the first thing I have to do, I'm going to assess the IV site, but I'm going to be talking to my patient and just asking if they've had a transfusion before. If they did, I would ask them how it went, if they had any reactions, you know, just make conversations with the patient, ask them how they're feeling. Oh my gosh, sorry, I'm having a lot of trouble putting on my gloves today. Okay, so, okay. So I'd go ahead and just, you know, be looking at the IV site as I'm trying to put on my gloves here. So I'm going to go ahead and check the IV site. I'm going to check here for any phlebitis, infiltration, ask the patient if it's hurting. They state no, so I'm going to go ahead and just assess the line, make sure everything looks clean, and it does. So then now I'm going to go ahead and clean the port for 15 seconds. I will let it dry. As I open up my normal saline, that will be drying. And then I would unclamp this tubing. I would go ahead and check for patency. So I would check for blood return. I see blood return, and I would go ahead and push some normal saline and then feel the site to see how it's feeling. Ask the patient if they're hurting, they feel anything uncomfortable. No, perfect. So I would go ahead and re-clamp it and throw this away. And then I would go ahead and at this time, because it is stated in the orders, I would go ahead and give the Benadryl, and because I need to give it 30 minutes before the blood infusion. And now that I know that this is patent, they're fine. So I would give the Benadryl, and then I would go ahead and tell the patient that I'm gonna come to over here on the side. They could continue watching TV, doing whatever. It will be on their phone, and I'm just gonna be over here on the side setting up the IV fluid. So I would get my normal saline, because we always have to run normal saline when we're giving a blood transfusion, always. So I would when I open the tubing, I would close all the ports. I would go ahead and spike the tubing. I would hang it up right here, And then I would fill the chamber. I would fill the chamber up to up right above the filter, and then I would go ahead and unclamp everything and prime the tubing. And once I prime all the tubings primed, the chamber's filled, I would go ahead and clamp the one that's connected to the normal saline, and I would go ahead and also prime, because it's a wide tubing. Oh, this side, sorry. I would go ahead and prime this part as well, the one that's gonna go connected to the blood. And then I would close all of them for right now. And then I would go ahead and connect it to my IV site. To my IV machine. So once it's connected to the IV machine, I wouldn't start it yet. I would go ahead and either go check the charts to see if the patient has any heart condition, any heart failure, or I could just ask the patient if they have any history of heart attacks, heart failure, any heart conditions. If they state no, I would go ahead and clean the port again for 15 seconds. And then once it dries, I would go ahead and connect this to the patient. I would tell them I'm gonna go ahead and just let some fluid run for now as I go get the blood. So since it's connected, I would go ahead and unclamp everything, and since they have no previous heart conditions or anything like that, I would go ahead and start it maybe for about like 5 milliliters an hour, and I will leave that as is with the patient. Then I would clean up my area, remove my gloves, and wash my hands. And then I would go ahead and grab all my paperwork to take to the blood bank, everything I need for the blood bank, tell the patient I will be back in less than 30 minutes that I need to go get the blood. So then I go to the blood bank. Oh, here it is. So I'm at the blood bank. Before they give me the blood, I will go ahead and wash my hands and put on some new gloves because I'm going to be touching the blood bag. Here is the struggle of gloves getting. So I put on gloves, and then I would get this paper. Oh my gosh, okay. I would get the blood bank slip, and there would also be a slip in here that the person that gave me the blood would have, and we would go ahead and compare everything. So we would compare the patient, date of birth, the blood type that they're receiving, be Rh negative, the expiration date, the unit number, the bag number, everything on here we would compare with the bag and the other paper that they have. And if it's all confirmed that it is the correct blood, correct patient, everything, I would put this back in the biohazard bag as well as the paper that they have. I would keep it all in here, keep my gloves on because I'm still holding on to blood. I would go back to my patient's room. Once I'm in, I would go ahead and knock. I would go ahead and introduce myself again and tell the patient, re-explain the procedure and tell them I'm sorry that I'm repeating this, but it's for your own safety and hospital protocols. So I would ask them for allergies. If they say everything's okay, then I would go ahead and call one of the other nurses so they could go ahead and confirm the blood with me as well. So I would call the nurse. We would have this paper, and we would go ahead and compare the blood together. I would make sure that I remove my gloves, wash my hands, put on some new gloves, and make sure that she has gloves on as well. So we would both compare the bag as well as we did with the blood bank to make sure that it's the right blood, the right patient, that everything is good, because we don't want them to get the wrong blood. So once we confirm that everything's good, me and the nurse would both sign in this paper, and now I would be able to administer my blood. So now that everything's confirmed, we would go ahead and hang the blood. And once we hang the blood, we would go ahead and spike it, but there's nothing to spike it with here, but we would go ahead and spike it, and the chamber's already full, this is already primed, and before I spike it, I would go ahead and stop the infusion before I spike it. Then I would spike it, and that way nothing's running anymore. So this is spiked. and I would go ahead and, make sure that everything's clamped. I would have to clamp the normal saline one and open this one. So before I start the infusion, I would go ahead and do vital signs for the patient because I need a baseline vital signs so that when I come back in 15 minutes, I can compare them. So once I do vital signs and they're all within range, I would go ahead and start the infusion. I would have to do my calculations to start the blood. So then once I do that, I would remove my gloves, wash my hands, tell the patient that I would be back in 15 minutes to make sure that everything's okay. I would unclamp everything, and and then I would leave. So then I would come back in 15 minutes. I would visualize the patient as I'm walking in, wash my hands, identify them, check for allergies, and if I see that they're not diaphoretic or shortness of breath or any of the anaphylactic reactions, I wouldn't go based off that. Still, I would see that they're okay, but I still would go ahead and do vital signs. So I would do vital signs. If they are within normal range, then I would go ahead and change the settings and administer the rest of the blood. And once I do that, that's it. I would just be coming back to check on the patient. And if they do have an allergic reaction, I would go ahead and stop the infusion. I would contact the provider, more than likely contact the charge nurse as well. I would have to take the blood back to the blood bank and get a blood and urine sample as well. And that's it.